Critical care. At any time, please feel free to pause or replay this video. Critical care is defined as the direct delivery by a physician of medical care for a critically ill or injured patient. A critical illness or injury acutely impairs one or more vital organ systems such that there is a high probability of imminent or life-threatening deterioration in the patient's condition. Critical care involves high-complexity decision-making to assess, manipulate, and support vital system functions to treat single or multiple vital organ system failure and/or to prevent further life-threatening deterioration of the patient's condition. Critical care services must be medically necessary and reasonable. Providing medical care to a critically ill patient should not be automatically deemed as critical care service for the sole reason that the patient is critically ill or injured. While more than one physician may provide critical care services to a patient, each physician must be managing one or more critical illnesses or injuries in whole or in part. The duration of critical care services to be reported is the time the physician spent evaluating, providing care, and managing the critically ill or injured patient's care. That time must be spent at the immediate bedside or elsewhere on the floor or unit, so long as the physician is immediately available to the patient. For any given period of time spent providing critical care services, the physician must devote his or her full attention to the patient and therefore cannot provide services to any other patient during the same period of time. Critical care is a time-based service. A split or shared E&M service performed by a physician and a qualified NPP of the same group practice cannot be reported as a critical care service. Time involved with family members or other surrogate decision makers, whether to obtain a history or to discuss treatment options, may be counted towards critical care time when these specific criteria are met. Time involved in activities that do not directly contribute to the treatment of the critically ill or injured patient may not be counted towards the critical care time. Time counted towards critical care services may be continuous or intermittent and aggregated in time increments. Here is a table representing the codes associated with reporting critical care services in relation to the total duration of critical care. Procedures that are not bundled into the critical care services, such as endotracheal intubation and CPR, can be reported in addition to the critical care codes. The time spent performing the pre, intra, and post-procedure work of these services shall be excluded from the determination of the time spent providing critical care. Please take a moment to review the following example. Time spent by the resident, in absence of the teaching physician, cannot be billed by the teaching physician as critical care or other time-based services. Only time spent by the resident and teaching physician together with the patient, or the teaching physician alone with the patient, can be counted towards critical care time. Time spent teaching may not be counted towards critical care time. A combination of the teaching physician's documentation and the resident's documentation may support critical care services. Teaching physician medical record documentation must provide substantive information, including the following: please take a moment to review the following example of acceptable documentation. The medical record is a legal document that is required by law and regulatory bodies. An incomplete or deficient medical record demonstrates that care was incomplete, contributes to inaccurate quality and care information, and causes lost revenue and reimbursement. This training video is brought to you by Practicefirst.